So thank you and welcome everyone to this fantastic program. It's been really inspiring to sit and listen to all the presentations and speakers this morning. So as Ruth mentioned, my name's Caroline Ford. I'm a clinical nurse specialist at the Mid-North Coast Cancer Institute in Coffs Harbour. I'm here today to take you into the world of an oncology nurse by walking you through an Essentials of Care project I was fortunate enough to be able to implement within my team. In particular, I'd like to invite you to appreciate the nature of the work that we do, the challenges our team face, give you a little perspective on how our lives are touched by working with cancer patients, and also take home some ideas and strategies of working towards a change of culture within your team. So a little bit about me first. I completed my Bachelor of Nursing in 1999 and I worked for 8 years in the intensive care unit of the Royal Brisbane and Women's Hospital, where I completed my graduate certificate in critical care. Once the 12-hour shift work got the better of me and I started to have my family, I decided to make a change in my nursing career, so I moved into the area of haematology and bone marrow transplant, where I got my first taste of cancer nursing. Over the years, I transitioned into oncology day units in Brisbane, Canberra, and now in Coffs Harbour, completing my graduate certificate in cancer nursing. I celebrated this family-friendly area of nursing where I could tuck my 4 children in every night, and it gave them much delight in knowing that I would be there for the Saturday morning sports and school assemblies. But oncology nursing, as I've since discovered, is so much more than this. It is an area that many nurses often go to for a lifestyle change, but little do they realise they are going to become a huge part of everyday people's worlds. They will be a hand to hold, a shoulder to cry on, a reassuring smile. We are part of their journeys, their grief, their anger, their milestones, their bad news, their good news, their lives, and their deaths. In mid-2016, an expression of interest went out in the Mid-North Coast Local Health District seeking participants in the Essentials of Care Mentorship Program, a pilot program offering successful applicants 1 day a week for 3 months away from clinical duties to plan and implement a practice improvement initiative in their clinical area, whilst being mentored by the Essentials of Care coordinator. So for those of you who don't know, Essentials of Care is a practice development program in New South Wales Health program focused on transforming practice to improve and enhance how care is delivered, and also staff satisfaction in the work they do. It is collaborative, values-based, challenges teams, and celebrates excellence in practice. It's a 2-year evaluation cycle of preparation, assessment, implementation, feedback, and re-evaluation. So as you can see, the 3-month mentorship program allowed me the groundwork to be done on our project. But as you can see, it is an ongoing process of evaluation, change, and growth. Many of us who are nurses involved in direct patient care can identify numerous ways of improving or changing our practice, implementing new ideas, and developing new ways of working within our teams. Yet what we are also faced with is a lack of time to do any of these things, or the job of creating change falls onto our educators, NUMs and CNCs, who all have their own workload to manage. So I jumped at the chance to apply for this 3-month program. So initial discussions with our team revealed a general sense of defeat and a long list of signs relating to compassion fatigue and burnout. Patient numbers and acuity have increased in our unit, with factors such as skill mix, staffing, and added pressure on the wider team directly affecting nurses' ability to manage our workload stress. This, coupled with exposure to grief via patient deterioration and death, contributed to challenging team relationships and low staff morale. These issues were brought to the forefront when the nursing team identified that our New South Wales Health core values of collaboration, openness, respect and empowerment we had documented proudly on posters in our clinical area were not necessarily being upheld in the way that we treated one another and worked as a team. We did, however, come up with common ground was that we all love oncology nursing, we all love our patients, we all work hard, we all need support, and we all want to be part of the solution. Hence, the Essentials of Care initiative was developed. Recognise, respond, resilience. Managing compassion fatigue in oncology nurses. So initial meetings were held between myself and my Essentials of Care mentor, Lorraine Brown, that were invaluable in guiding me to create a mind map and practice development agreement which gave me direction and allowed me to stay focused on the goals of the initiative, which are to raise awareness, to develop strategies and provide resources, to work out ways of how to care for ourselves and each other, and increase our nursing team morale, motivation, cohesiveness and resilience while putting our core values into practice. So as I've already mentioned, cancer nursing is challenging in many ways. Compassion fatigue and burnout are risks associated with work as an oncology nurse due to the often emotional and personal nature of the work we do. Compassion fatigue is a common theme, often seen in helping professions. The emotion, empathy and intuitiveness required for helping others can leave us vulnerable to compassion fatigue, as we can often feel like we are not doing enough or being enough for our patients who are going through a stressful period in their lives. So there were a number of reasons we decided to focus on raising awareness of compassion fatigue. There are both positive and negative aspects of working in a helper role. Both contribute enormously to our professional quality of life, which is the term we use to describe the pleasure we get from being able to do our work well. And the majority of nursing staff in our unit were feeling more fatigued or focusing on the factors that impact compassion fatigue in a negative way, rather than the aspects that derive them satisfaction for caring for cancer patients. It is important to recognise that compassion fatigue and compassion satisfaction are both influenced by the same variables and how we as individuals perceive them. So our ability to provide care, are we supported with policies and procedures, education and professional development opportunities? Or do we often find ourselves unsupported and with no time to focus on developing our career? How do we work together? Do we know each other? Do we trust and respect each other's professional opinions and decisions? Are we restricted with barriers? Are we empowered by management? Is our workplace fair and equal with its workload distribution? What are our own beliefs about ourselves and our own ability at work? How does our workload impact? Does it have a positive or negative impact on our ability to deliver quality patient care? Do we have respect from our patients and from our colleagues? And do we work together? Do we have the support of our colleagues and our managers? So when we reflected back on our values as a team, many of these aspects were at the forefront of our concerns. So it made sense to look at how we all feel to gather some data about our professional quality of life via the ProQol Survey. So the ProQol Survey is the most widely used measure of positive and negative aspects of being in a helper role. It's available online. And it's a 30-question survey. The questions vary from, for example, I'm pleased with how I'm able to keep up with techniques and protocols, or I feel overwhelmed because my workload seems endless. So you get to score this from always to never. It's important to keep in mind the subjectivity of the data that we gathered as well, because it's influenced by so many variables. For example, when we gave out the survey, staff going away on holidays might fill it out completely different to someone who's just come back from holidays. Staff who might have something going on at home, family stresses, would fill it out very differently to those who don't have those pressures at home. So we put 19 surveys out, 13 were returned and completed. So as you can see here, we had roughly even numbers of compassion fatigue and satisfaction. So what that revealed to us, that we're feeling the pressure of being in caring roles, but we are also getting positive reward from the work that we do. So this led us to get back to our values and think perhaps that some of it was about perspective, resilience, support, and awareness of the factors that contribute to our own professional quality of life. So once we had ascertained where the nursing staff were with their perspectives, I put the results out for staff to see, sought opinions and feedback on what they would like to see come out of the project. So now came the challenging part, engaging our team. I worked closely with my mentor on engaging staff and identifying our common goals for the team. Using the principles of appreciative inquiry, my mentor worked closely with me to help me look at what's working well and how to improve on it, rather than what's not working and how to fix it. She also helped me change my focus on how and who I was trying to engage. Rather than trying to sell my ideas to people, I focused on those who were already on board and who wanted to be compassion champions. I used a number of different ways to engage staff and spread excitement and optimism about the project, primarily picture boards, staff profiles, gratitude jar and social activities. So picture boards were placed in all clinical areas to keep staff updated with the progress of the project, inviting them to post a daily quote or share a journal article or funny picture. They've been avenues for education, awareness, with tips on self-care and resilience, and they centred around the 6 C's of compassionate care, which are care, compassion, communication, competence, courage, and commitment. So staff profiles were created as a way to get to know one another and develop a sense of respect and understanding, reinforcing that we may all be different but each have something special to offer our team. Staff who participated in this were referred to as compassion champions, enforcing the values and goals of our team. The gratitude jar was a fantastic and simple idea to spread the love in our unit. It was placed in a central location and allows staff to write something they are grateful for on a slip of paper that we collate and laminate monthly for all to see. The notes range from thanking other staff to appreciation, acknowledgement and encouragement for what others have done. The Essentials of Care mentorship program provided much needed time to build the foundations of the initiative. Future plans include focus on resilience, self-care, mentorship, and avenues for staff to debrief. The project, like most, had many challenges and highlights along the way. So knowing where to start. For individuals and teams wanting to start an initiative to create change, find a mentor or someone to guide you and get you to think outside the box. Personal growth. So I underestimated the professional growth that I experienced in my own ability to be a leader, to engage colleagues, and to initiate change and improve practice to provide quality patient care. Use the principles of appreciative inquiry to work out what is working and improve on it. Don't focus on what's not working, as you will constantly be putting out spot fires and being reactive rather than proactive. Work out how to work with different personalities. Develop strategies to work with different people. Create an identity. So when we created the logo, it felt that the project was more identifiable to people, that it had substance and could be transferred to other settings. So finally, put yourself out there. Be proud of your achievements. Although this initiative is still in its infancy, I've had great opportunities to present the work at other conferences. By creating an awareness of compassion fatigue in cancer nurses, we still haven't found that big pot of glue to stick us all back together. We have, however, opened the lines of communication and in essence given our nurses permission to be open and honest with our battles. We are working towards being more empathetic towards each other. Showing a little kindness in the face of adversity, we are slowly standing up and seeing that we are indeed all human. We all have stories to tell. On that note, I would like to share a very brief clip of our team in action. Sorry if I can work out how to start it. Is there sound? Yeah. don't think the sound's working out there now. Is that working? Sorry, the sound didn't work then. Thank you.